What's going on, everyone? Happy Monday to everybody. Hope you're having a great start to the new week. It's time for today's pandemic update for Monday, April 3rd, 2023. So remember over the weekend we were talking about how Maine positivity was starting to rapidly rise on the Walgreens map? And you'll see the latest update for that in a minute. Well, guess what? The Maine governor has now tested positive. So that really supports what we're seeing on Walgreens is legitimate. Things are starting to get bad up in Maine. And here you go. Maine governor tested positive for COVID on Sunday, April 2nd, 2023. That's this year. Currently, she is 75 years old. This is not the first time she's tested positive. I don't have an exact date of when last year, but I do have a month. And it was April of last year. I seem to remember when she did that in April last year. But I don't have an exact date. And if you Google this, there are a ton of sources that come up for this one. I saw at least 10 to 15 different articles. But yeah, the governor of Maine has now tested positive. Moving on to this. And this may be a little bit confusing for some. But it says here, what happens when the CDC, or what happens when the COVID-19 emergency declarations end? Implications for coverage, cost, and access. Well, I kind of skimmed through this a little bit earlier, and I think the number one thing that is going to end that a lot of people don't realize is if you want to get a test, you're paying for that out of your own pocket. Unless you have really good coverage, it's going to continue paying for it. Another thing that may end for a lot of people is the cost of getting a vaccine. That might get passed down to you for millions of people. There's a good potential that you're going to have to pay for that out of pocket now. And there's still some discrepancy of just what that's going to be. Remember Moderna said at one point, oh, we're going to make it free to Americans, or it's going to be low cost or whatever. Now, lately I've read another article where the CEO said, no, they're going to charge a lot for the vaccine booster doses. Which brings me to my next point. I'm seeing a lot of chatter on Twitter and social media around, should there be a second booster now? Now, I personally am not a medical professional, but I can tell you this. For me personally, I haven't had my last booster shot since September of last year, which was the bivalent booster. I personally would like to get another shot right now. So, for people who are immune compromised, I'm on the low end of immune compromise. I do have asthma. But the point being made here is, I think for people who are immune compromised, if they feel they want to get a booster shot now, I think they should be allowed to. And I saw Dr. Peter Hotez is advocating that, yeah, immune compromised should get a second booster shot. So, yeah, I think it's time. I mean, I'm in agreement with the people who are saying, yeah, they want to get another booster shot. And if they approve it, would I go out and get one? Sure, because it's safe. The vaccines are safe. All right, moving on to this now. Some more bad news out of India. Like we haven't had enough bad news out of India recently, but the rocket ship that's going on in India, it's continuing. India on Sunday logged 3,824 COVID-19 cases, the biggest in 184 days, while the number of active cases increased to 18,389. And remember, folks, this is a huge undercount. There's over 1 billion people in India. And you're telling me they only had 3,824 cases. They probably likely had over 10,000 cases. Maybe over 20,000 cases. Don't know, but we know the number is significantly higher. Because not everyone is getting tested. Just the sheer volume of celebrities that we've seen tested positive in India as of lately, that alone is a clue that their surge right now that's going on is massive. Now, the wild card with this is, though we're still watching it rapidly go up, at what point is it going to stop going up and rapidly go down? Because this is very similar to BA.1, where you had a rapid rise, then it rapidly dropped, and then a couple months later you had another wave, which was BA.2. So we'll have to wait and see what happens. All right, today in COVID history, we do have some COVID history today. April 3rd, 2020. At a White House press briefing, CDC announces new mask wearing guidelines and recommends that all people wear a mask. when outside of the home. CDC warns the public about phone scams and phishing attacks that appear to originate from CDC and asks for donations from individuals. This is government impersonation, fraud. Federal agencies do not request donations from the public. Well, I can share with you a brief story. I had a phone call about, I want to say 9 months ago now, claiming they were the CDC, claiming they were taking a survey on something. I don't know if it was ever actually the CDC, but the guy was asking all these different medical questions. None of it was related to coronavirus. Where they have the time to come up with something like that in the middle of a pandemic? Asking all these health, have you ever had this procedure done at the doctor? Have you ever had that procedure? I'm like, you should be asking me questions in reference to coronavirus. How do I feel about how you guys have done with coronavirus? Because you all know how I feel about that. I feel they should be doing a lot more, but hey, it is what it is. All right, moving on to wastewater. I want to show you this in the wastewater today. This is from last week, but I want to show you this for a reason. I've seen a few people on Twitter state, oh, everyone's panicking about XBB 116. Oh, but we don't see signs of it rising yet. Whoa, wait. Here's national wastewater. All 4 regions of the U.S. are starting to rise on national wastewater. That's a sign of a wave starting to come that could be driven by either XBB 191 or XBB 116. Right now, it's probably a combination of both, but I still do think 116 will eventually take over, just based on what we're seeing in India. And the same people are also saying, well, you can't base what's happening in India to here. Yeah, you can. Look at some of these positivities in some of these states on Walgreens. Maine, for example, which is now backed by the Maine governor testing positive. All right, moving on to this. Here's the national wastewater surveillance. We didn't see really much in the way of updates. There's still a lot of gray areas. There is good news. Look at all these blue areas, these darker blue. That's lower percentages of COVID. You still have all these orange areas in the Ohio Valley. Some of them are light blue, which is on the cusp of moderate. And that is concerning. But some of them haven't updated in a while. And then we have all these gray areas. I don't know what the deal is, why a lot of places are not reporting. And it's scary because May is coming up next month. That's when the pandemic emergency ends. And it's scary to think that when May comes, is anything going to be reporting? Who knows what will happen? I'll still be here reporting daily. I'll find stuff. There'll always be news stories about the pandemic. All right, moving on to this. Here's the transmission. 994 counties are in high transmission. 695 are in substantial. 1,174 are in moderate. 359 are in low transmission. Moving on to the variants. Here you go. XBB 15, 87.9%. XBB 191, 4.6%. XBB 2.5%. XBB 151, 2.1%. And BQ 1.1, 1.9%. Then you have about 3 that are under 1%. All right. BNO's weekly update yesterday. This was the total number of cases for last week, and here you go. New cases, 160,412. The weekly, the average is now 161,142. That's actually down by 17,967. States reporting, 49 out of 50. Here's your state that did not report, Mississippi. Hello, Mississippi, if you're watching this video, please report your cases. I get it, you were very busy because you had a tornado the week before, but the tornadoes did not damage your health facility where you collect the data. Your health department did not get damaged. Could you please report your cases? Thank you. All right. In hospital, 18,702. That's down by 1,565. In the ICU, 2,740. That's down by 135. New deaths. Still 1,944. That's still higher than the flu does. That's still higher than the other viruses. And this is deaths on top of all those other things that would normally happen. So yes, that's still too many deaths. The average deaths did drop ever so slightly by 39 to 2,058. And it's only a matter of time till we see the case average either level off or eventually start rising again. Don't know when that's going to be. My guess is probably the end of this month, or maybe it may not even be till May, just because of testing. There's not enough people getting tested. All right, New York State positivity here. New York State, 542 new cases in the last 24 hours. 2.4% positivity. 1.8% is the 7-day average. Hospitalizations in New York State, they are below 1,000. 947 people hospitalized, 97 people in the ICU. Let's take a look at some Walgreens data, shall we? 25% positivity nationally. The difference over last week is now only 0.2%, making last week at 24.8%, 15,688 people tested. Prior week, 17,731. Let's start off with a tiny little bit of good news. Take a look at the chart here for Maine. There's signs here that Maine is finally peaked off a little bit. It was 45% yesterday. I know this says 44.7%, but it was, there you go. It was 45% yesterday. Today it's at 42.9%. Still a difference of 22.9% over last week, but that is ever so slightly down over yesterday. And by the way, going back to Maine, they are at 42 total tests this week, 30 tests last week. Taking a look here at New Hampshire, 34.4%, but then we come down here to Connecticut. Connecticut's rapidly starting to rise, 16.9% this week, 10.5% last week. Yes, testing is down, but that's a 6.4% rise. You also have here Rhode Island, which is rising 17.3%. And that's up by 10.8% over last week. 6.5% was the positivity last week. 81 total tests this week, 92 last week. Florida's rise is starting to get a little bit faster now. 28.3% positivity. Prior week, 24.9%. Wisconsin's one's that's been rising, but it leveled off a little bit. 34.6% this week, 30.6% last week. Wyoming, or Montana, then Wyoming, 38.5% positivity. That is up by 24.9%. Prior week was 13.5%. California, 23.8%. It is flat over last week, 23.7%. And finally, we'll end it on Texas, 27.4% positivity this week. The prior week is 26%. Briefly taking a look at a little bit of international data. South Korea is now flat week over week. You come down here, India still up 73%. So yet another week where India has risen again, as we have been saying. Romania up 8%. Greece is down 65% on cases. And I wanted to show France. Though France cases are now down 14%, take a look at their deaths. They're now up by 35%. And we'll do one more and end it there. Indonesia, cases are up 24%. Deaths are up 43%. That's super concerning. Alrighty, that does it for today's pandemic update video. We'll have another one of these tomorrow. If you liked or enjoyed this video, and you like being updated about the pandemic on a daily basis, first off, give this video a thumbs up. Second off, subscribe down below, and I promise to continue doing these and help keeping you and your family safe, because that's really important. That's what this is all about. We're all in this together. See you all again next time, but until I see you next time, stay safe, everyone.